Welcome everyone to today's webinar, Thinking Outside the App, Creating Frictionless Patient Experiences. I'm Aaliyah Pavela with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I am pleased to turn the floor over to Jim Gaffney to introduce our speakers and begin today's presentation.
Thanks so much, Aaliyah. My name is Jim Gaffney. I'm the Chief Strategy Officer for Ensemble Health Partners. I'm very glad to be here and help MC today's presentation. We're excited to talk about patient experience. We know that every C-suite and almost every board for health systems in the country are trying to deliver on a better patient experience, but they don't always know how to get there or what that truly means. Today, we're excited to hear from some of our team at Ensemble, as well as a leading health system, Atrium Health, about our view on delivering on a patient experience. Today's call, you'll hear from Justin Ivey, the founder and CEO of Ensemble Health Partners, Dan Melillo, the Chief Digital Officer for Ensemble Health Partners, and the founder and CEO of Odessa, Liz Blackburn, Vice President of Operations Performance Improvement at Atrium Health, and Sarah Shaw, Assistant Vice President of Operations Performance Improvement at Atrium Health. Today, we're going to cover a couple different topics. Looking at the market, understanding what consumers want, why, and what's driving them to those demands. We'll talk about creating a frictionless digital experience to meet the demands of the patients. We'll hear a little bit from Atrium on their journey in innovative digital engagement. And then finally, we'll talk about what's next for patient engagement as there's expanded use of automation and artificial intelligence. And then, as Aaliyah mentioned, we'll open up time at the end for some Q&A. I'm proud to introduce Justin Ivey, the founder and CEO of Ensemble Health Partners, to give a brief overview of the company.
Thanks, Jim, and good afternoon, everyone. First and foremost, I want to thank Liz and Sarah for taking their time today to share their story with us. I think Atrium is seen as a market leader in many instances in a number of areas, but I think hearing their story and seeing how the patient experience is evolving, even with systems that have significant market share such as Atrium, is very important for an opportunity for us to all learn from their experience. A little bit about Ensemble. We started the company, and we say it's a company that was started by operators for healthcare providers. And today we serve more than 400 hospitals across the country, 8,000 providers, including mid-levels and physicians, and we manage $22 billion of net patient revenue through our end-to-end offering and see in excess of almost 80 million patient encounters a year. What's very interesting about patient engagement, and I'm excited to hear the story and share the story of Atrium, is that if you had looked at revenue cycle 10 years ago, there was no mention of patient engagement. We saw our jobs as registering those patients that appeared on our doorstep the morning for their scheduled procedure, putting in the charges, and then working through the billing process. And yes, there were things such as pre-registration and scheduling programs, but a complete transformation of the landscape where we all have to look at patients as consumers with choices, with options on how they want to be engaged. And I think the tip of the spear for a high-performing revenue cycle organization is how we not only focus on net revenue as a blocking and tackling of what we do as a revenue cycle organization for health systems, but also the tip of the spear being focused on how patients want to be accessed, how that creates volume for hospitals, how that retains patients inside the four walls of the health systems and the health system network. So I'm really happy today to be here with Liz and Sarah and have them share the story of Atrium and with Dan of our Odessa team about how they're transforming the patient experience within their system. Jim, I'll turn it back over to you.
Thanks, Justin. Dan Malillo is going to give a little bit of background on why he started ODESA, what he sees in the market, and what's really driving this change in consumer behavior.
Thanks so much, Jim. Really appreciate it. Really, ODESA was started for the purposes of fulfilling the experience in healthcare that really, I've wanted myself, right? So as somebody who's very technology-centric and was experiencing a lot of great digital experiences with other industries, felt very strongly that the healthcare industry was going to eventually need those same types of experiences in order to compete with a lot of the landscape changes that were happening with other industries starting to enter healthcare. So we wanted to really just kind of go through the ODESA journey by kind of talking about the underlying strategy and some of the types of solutions and things that we found. So to kind of kick things off, we've all heard about the rise of consumerism in healthcare. And at a high level, patients now expect the same engaging and convenient customer experiences they've grown accustomed to in other consumer industries like retail, travel, and banking. And so today, patients are seeking care on their own terms by shopping for new levels of provider access, convenience, and customer service. So let's dive deeper to explore the underlying factors that are driving modern consumer demands. The first driver is what has become known as the Amazon effect. So as we all know, consumer tech companies like Amazon, Apple, and Netflix are leading the way when it comes to improving experiences, personalizing interactions, and influencing behavior. And consumers are now accustomed to their value-added amenities and dynamic digital experiences. So as a result, new for-profit competitors are capitalizing by entering the healthcare market and offering the same convenient, personalized consumer experiences as these tech companies. The second driver is the fact that millennials have eclipsed baby boomers as the largest percentage of the U.S. population. And this is a generation that was really raised on digital convenience. So for them, any perceived barrier to access may result in healthcare dropping low on their priority list. Accessibility to care, when, where, and how consumers prefer to engage is highly valued and affects millennial behavior. The third driver is the fact that the COVID-19 pandemic increased consumer reliance on digital technologies for many daily activities. It solidified their expectation for convenience and speed to access. On the flip side, for overburdened providers, the pandemic turned into an unintentional case study, really proving the versatility of digital health technology as a result. And this technology was a force multiplier at a time when resources were stretched. Digital health technology became a tool to quickly automate and scale frequent communications to their entire patient population. It was a way to triage priority patients and even a means to coordinate vaccine distribution. So maintaining the status quo is really no longer an option, and providers who don't deliver a more consumer-like experience are jeopardizing revenue and competitive advantage. So here's a look at just a few of the numbers that support that case. First off, we all know that patient portals are an excellent point of initiation for patients when they want to ask a question to their provider, view their clinical information, things like that. But, in terms of communication workflows, the overall adoption and ability to reach the entire patient population using the portal as a one-stop shop for engagement hasn't been what we hoped. In fact, 1/3 of hospitals have said that less than 10% of their patients have adopted their portal, while fewer than 10% said most of their patients have adopted it. So as a way to really augment the portal, because we know that the portal is important. It's a key part of the digital strategy that every healthcare organization in the United States will continue to use. But really, to help augment that, introducing enhanced digital communications that fall outside of the portal and reach the patient where they are, those that use two-way integration to the EHR to communicate with consumers using their preferred communication channel, whether it be text, email, or IVR phone calls. This is going to allow providers to reach the entire patient population and deliver a more seamless experience for the consumer. All right, secondly, let's look at the cost of unfilled appointments. Pretty astoundingly, research has shown that at least $150 billion of revenue is lost each year in the United States due to unfilled appointments resulting from cancellations and no-shows. As a solution, we've seen that automated communications sent through text, email, and IVR phone calls at the right cadence will enable patient self-waitlisting at over 25% opt-in rates, and also increase appointment slot utilization by over 52%, all by automatically backfilling open appointments from the waitlist. Additionally, digital appointment reminders with the ability to self-reschedule via text message can reduce no-show rates to 5% or less. Finally, when it comes to patient satisfaction, a quality digital experience will drive patients to or from providers. In fact, the research has shown that around 50% of patients are willing to switch to a new provider that offers higher quality digital services. So how do we create frictionless digital experiences for today's highly connected healthcare consumer? The simple answer to that question is by combining accessibility and convenience. So we think about the keys to creating a seamless digital experience in 4 ways. 1, make it simple and frictionless. 2, hardwire it to become default. 3, make it part of the consumer's daily lives. And 4, make it personal. We believe that these are the keys to creating lasting loyalty. So here are a few ways digital communication tools can contribute to that. Let's take a look at how they line up against app-only strategies. So I think we can all agree that accessing a new app for the first time can be cumbersome. It usually involves getting a download code or an access link from the clinical staff. And overall, the app will require extra action on the part of the patient. For digital communication tools, such as text messages, emails, IVR calls, the patient simply provides their phone number and/or their email, and they're all set. All right, the next one. For apps, push notifications have lower open and response rates than text messages and are often cleared or ignored by the user. I'm sure we can all relate to that. I probably have 50 different push notifications on my phone right now. Alternatively, though, text messages not only have an increased likelihood of reaching every user, they're also viewed with more urgency. Indeed, 99% of texts are opened within 3 minutes of delivery, while push notifications range from 7 to 48 minutes, according to research. When it comes to navigation, the added steps for accessing and using apps creates perceived barriers that result in high rates of abandonment. In-app errors or glitches also diminish the user experience and are hard to control. Alternatively, the overall ubiquity of texting means messages reach the broadest population of patients, bringing features to a patient's point of need. So with an app, when you receive a notification or want to perform an action, you must open the app, wait for it to load, possibly log in, navigate, etc. With digital communications, you receive a text, open it, and take an action. The anytime, anyplace simplicity means patients are more likely to action on a call to action immediately. Yeah, just in general, texting is a more patient-centric approach. The seamless, convenient experience increases engagement and overall satisfaction. And finally, when it comes to unification, for apps, juggling multiple apps, logins, passwords, it can become confusing and definitely frustrating. The beauty of meeting the patient where they are, using their communication channel of choice, whether that's text, email, or an IVR phone call, it allows you to unify these communications and have one single platform that's controlling that messaging. It comes with a ton of different benefits that I'm sure the folks at Atrium can attest to. So with that said, at this point, I would love to introduce Liz Blackburn and Sarah Shaw from Atrium Health. Liz is the Vice President of Operations Performance Improvement, and Sarah Shaw is the Assistant Vice President of Operations Performance Improvement on Liz's team. Liz and Sarah, thank you so much for joining us, and please feel free to take it away.
Great, thanks, Dan. So we'll start with an overview of Atrium Health. Our mission is to improve health, elevate hope, and advance healing for all, and that is the driver behind everything we do. Last year, we recognized the need to enhance our communication offerings to provide different options and easier ways for patients and consumers to connect with us. Our goal is to build brand loyalty and drive patient selection through providing consistently excellent service through enhanced technology that offers convenience and connection. We also continue to be very focused on creating safe passage for patients by offering a digital touchless check-in experience and an alternative to waiting in the waiting room. We partnered with ODESA to build and launch our communication program. This program includes 5 major projects: consumer chat, appointment reminders, text referral management, virtual waiting, and a new check-in experience. Our strategic objectives for the communication program are to offer 24/7 connection through text and chat, create a safe and personalized experience, and reduce customer effort. This is a visual of what we're trying to achieve. Walking through the patient journey, it could start with chat, where a patient or consumer can schedule their appointment. Once the appointment is scheduled, a text reminder is sent, and the patient can reschedule via text. Before the appointment, the patient can complete e-check-in and pay their copay. The patient then drives to their appointment and receives a virtual waiting text asking them to text here when they arrive. The patient will receive a text when the provider is ready to see them. In the near future, the patient will receive a text after the appointment providing an update on their referral appointment. Then they will be able to schedule that appointment via text.
The Atrium Health Ops Performance Improvement team partnered with our Information and Analytics Services team and operations leaders to launch our patient communication program. We are very excited to offer a more digital experience for our patients, and I'll provide a brief overview of each of the projects we implemented here at Atrium Health. We have been live with consumer chat for 4 months now, and it is available on our atriumhealth.org homepage and other frequently visited pages on our site. The chatbot and live chat are available 24/7 for general questions and to schedule appointments. With consumer chat, we also implemented chat routing, which allows us to connect our patients with specialty teams that can answer their specific questions. For example, we can route patients to our Cancer Institute and behavioral health. In the near future, we will expand to gastroenterology and cardiology specialties. With appointment reminders, we have been live for 4 months with all of our ambulatory care divisions. Patients have the option to confirm, cancel, or reschedule via text. And we also implemented care gap management, which enables us to proactively reach out regarding care, and this helps to remove the burden from the patient. Based on patient feedback, we have learned that patients prefer ongoing communication throughout the referral process. Coming in first quarter of next year, we will implement text referral management, where the patient will receive a text when the referral has been received by the specialty department, and then again when the appointment is ready to be scheduled. The patient will have an option to chat online with a care coordinator to schedule the appointment, or they can call and schedule. This is a much more convenient option for our patients and keeps them informed of the progress of the referral. For virtual waiting, we really identified the need for this technology during COVID and the need for safe passage for our patients and teammates. We have been live for 4 months, and the patient receives an automated text 1 hour before their visit. When the patient arrives at the practice, they text here and are able to wait where they are most comfortable, for example, outside of the practice. Our front desk teammates and patients are able to text each other if additional information is needed for check-in, and the patient will receive a text when the provider is ready for them to come in. Since implementing this new technology, we are able to reevaluate our check-in process and work to design a digital touchless experience. We will enhance e-check-in so it is the same experience as in-person check-in, and this gives us the opportunity to retrain on customer service and improve adoption for our patient portal. As you can see, each of these is connected to allow new ways for our patients to connect with us, and we have seen some great feedback from our patients. In our patient experience survey, we do not ask any questions about virtual waiting, but many comments have been received, so we wanted to share some patient feedback. I'll share a couple of these with you from the slide here. Levine Children's Shelby Children's Clinic. I appreciate still being able to check in by phone and wait in the car. I hope this continues in the future. I prefer to stay in the car rather than sit in a waiting room with children who are sick. Another comment from Levine Children's Rock Hill Pediatrics. I love the new check-in method through text message. Instead of waiting in the lobby to check in and exposing my children to sickness, I am able to check in through text message and wait in my car with my kids until I get a room number. And then lastly, from Eastover University OBGYN, the new texting system is awesome. I can stay in the car until my provider is ready. In addition to this feedback, we have seen high engagement from our patients. Since we have been live for the past 4 months, we have some early results to share. For appointment reminders, we have seen a 62% response rate and a 92% confirmation rate. And since we created this slide, we've seen an increase in the appointments rescheduled, up to 7,800 appointments that have been rescheduled via text. Prior to implementing this workflow, these would either be canceled appointments or phone calls to reschedule. For virtual waiting, we have launched this across all of our care divisions, which is 335 practices that are live with approximately 9% patient adoption rate. We are now in our operational support phase and working with our marketing team to educate patients on this offering and increase patient engagement.
As Sarah mentioned, we launched Consumer Chat April 8th. Here's a computer and phone view of chat on our website. The chat bot offers multiple prompts which expand with additional information or take you to another page within our website to provide answers to questions. For example, if you select Get Care Now, 6 prompts appear. 3 take you to web pages and 3 are FAQs that once selected show the answer. It is connected to our provider directory, which allows patients to schedule an appointment through chat. The live chat feature is available 24/7 and will directly connect you with a teammate to answer questions, help with scheduling an appointment, or connect you to another team to help, like the billing team, for example. Since launch, we have now served over 16,000 patients virtually, and teammates have chatted with over 1,200 patients in the last 3 months. In addition to providing patients and consumers with multiple ways to interact with us, We hope to see an increase in scheduled appointments online and a reduction in phone calls over time. We are thrilled to be able to offer patients each of these services to continue to improve the experience and better connect care.
Sorry, I had to unmute myself. Liz and Sarah, thank you so much. That was great. Really, really appreciate it. So you've shared a little bit about the why and the what behind Atrium's communication strategy. Now I'd love to talk more about the how, if you're up for it. I have just a few questions for you. First one would be, once you gained buy-in from internal stakeholders at Atrium, how did you go about operationalizing digital communication tools into your existing workflows?
Hey, Dan. Yeah, this is something our leaders, patients, and teammates recognized was a need at Atrium. The Ops Performance Improvement Team and ODESA collaborated to define scope for each project, and then we partnered with each service line who provided a representative to design, implement, and best incorporate with their existing workflows.
Excellent. Yeah, it makes perfect sense. Second question, did you have an implementation success plan for the rollout? And if so, what did that entail?
So we defined measures of success ahead of time, and so far we've already seen successes in the short term that we have been live with our program. So for example, with appointment reminders, we measure confirmation rate, reschedule rate, and no-shows. For virtual waiting, we measure patient experience and adoption rate. And then for chat, we measure consumer satisfaction, the volume of phone calls, appointments scheduled via chat, and the number of live chats and automated chats.
Fantastic. Thank you so much. All right, final question. What 3 takeaways would you offer today's audience in terms of defining scope, customizing to needs, and ensuring continuous improvement?
So in terms of scope, look at what are your patients telling you that they need or that they want, and what is your data telling you? We learned from our patients that we needed to provide a modernized way of connecting with us, providing updates about their appointments and care, and an alternative to waiting in the waiting room. We also learned from our data that we needed enhanced technology to reduce no-shows, reduce phone calls, and reach people to allow them to schedule referral appointments on their schedule. When it comes to customizing to needs, the consumer expects a personalized experience, just like you mentioned earlier, Dan. It's important to understand what that means to the consumer and how to deliver. And to ensure continuous improvement, it has to be operationally designed and led. The operational leaders are responsible for successfully executing this program, so they need to own it in order to drive it. We partnered with our operations leaders in each service line to design and launch, and will continue to support to enhance each offering.
Excellent. Thank you so much, Liz. All right.
My turn. This is Jim Gaffney again from Ensemble. Judson and Dan, just want to ask a couple questions of you all from what we're seeing in the industry. Dan, what do you see trending right now in the industry as far as digital patient engagement, especially as this technology becomes more available?
Yeah, Jim, I mean, the biggest thing is really just focusing on what trends are happening in other industries and really kind of playing into the way that patients are, viewing themselves as a true consumer within healthcare, whereas, years and years ago that kind of was less of the case. But now patients are paying more out of pocket for their healthcare than they did in the past. They definitely are feeling more like paying customers, and in turn, they're expecting the same engaging and convenient experiences they've grown accustomed to. And so I think that it's going to be really important for the tools as they're being rolled out to integrate as much as possible with the EHR. It's about creating a seamless experience for the patient, but equally as important is to create that seamless experience for the provider staff, so that the workflows are truly being enhanced by this technology, and it's not creating a lot of operational change that needs to be accounted for.
Yeah, that makes a lot of sense, Dan. Do you see a greater demand or need as we talk about interoperability, meaningful use, patients really wanting consolidated views? What do you see in terms of having all of their information in one place and understanding both the clinical and financial picture when it comes to healthcare?
Yeah, I mean, having all the information in one place is super important. If you're trying to create a omni-channel communication strategy with a patient where patients can engage from various points, so not only from receiving messages through text or an email or a phone call, they can also go on the website. As Liz showed, consumer chat is opening up this 24/7 accessibility for patients to talk with live agents. I think in the future it's going to be important to be able to incorporate chat into other digital footprints like your Google My Business page, your Facebook page. There's going to be a lot of business chat that's going to be opening up here in the future. Apple Chat is another platform that's going to be coming soon that I think is going to be really interesting. So the unification, though, becomes really important because you need kind of a single platform that can control the flow of messages, right? What we've seen is that patients will opt out of receiving messages if they perceive them as unuseful. And so if things are being sent kind of indiscriminately where there's multiple vendors and they don't talk to each other, and so messages are just going around based on different data triggers, it's not really purposeful and useful for the patient. And so that unification is really all about having a system that's intelligent and knows what messages are being sent and when, and being able to intelligently create pauses so that information can be delivered, absorbed, and then the next kind of batch of information is brought at a later time when it's appropriate.
Yeah, that makes a lot of sense, Dan, especially some of the message fatigue, as we mentioned, the badges and alerts and push notifications that people get, being much more intentional and meaningful with outreach. Could certainly understand from a consumer perspective myself. Judson, as somebody who spends quite a bit of time with some healthcare leaders in the country from some large healthcare organizations, what are you seeing and hearing from providers? What are they asking for? What's on their mind?
Yeah, Joe, I think you've got what I hear from CEOs and CFOs and leaders within health systems is there's a lot of macro trends that are working against health systems. So you have, certainly competition among regional players. You then have macro trends where payers and insurance companies are redirecting patients to different levels of care. And then you have competition in the marketplace among freestanding imaging centers, other alternatives in which either physician-owned entities or private equity-owned entities are all competing for the same patient base. And the four walls of the health systems, we have the overhead, the operating overhead, and the responsibility to care for everyone. And so we can't pick and choose who we care for. It's the nature of a health system. And so what I hear from leaders is, look, we need to, one, keep our patients, but also attract and tell patients about the quality care we have here, but we need to make it easy, as easy it is for them to walk into a freestanding imaging center, or as easy it is for a payer to try to redirect level of care to a different setting. We need to make sure that we're meeting the patient where they are. And we have to change our mindset around patients are coming to us because we have the best equipment or the best staff. The reality is that all of us most likely have the newest CT machine. So patients are no longer coming to health systems believing they're getting the best level of care or equipment. Instead, there are other factors that are influencing how they engage for their health care. And so I think there's an overwhelming demand from health system leaders to say, how do we transform this process, which has been the typical scheduling rescheduling, registration, and it's been cumbersome and, quite frankly, technologically much farther behind than other industries. And we're hearing we have to do this now in order to preserve our patient volume, but hopefully increase patient volume and how we interact with those patients. So I think it's an overwhelming demand from health system leaders to say we must transform this process sooner than later.
Yeah, absolutely. I think that makes a lot of sense. And it's really for either, but I think, Dan, as you started out founding the company, a lot of it was just providing some of the tools that are readily available in retail and banking and other industries, and some of the frustration around that. As you've continued to work with health systems and create new use cases, have you seen a greater demand in use case requests for things around value-based care and really influencing population health as we've expanded away from kind of purely financial registration administrative functions? And do you think that some of the tools like ODESA and broader automation and AI really could be a key to unlocking a greater penetration of those types of markets, as it's been traditionally very, very challenging to influence patient behavior in a meaningful way?
Yeah, absolutely. I mean, you think about like the emergence of these alternative payment methods in value-based care, it really, healthcare providers face additional complexity when you kind of consider that. So, value-based payment models are going to be linking provider revenue to the ability to maintain patient loyalty and to engage patients in their health improvement. Right? So, I mean, in order to get paid, providers had to move away from fee-for-service payment models and instead adopt alternative payment models for value-based reimbursement, as well as risk-sharing models like merit-based incentive payment system. I think these types of payment models are projected to just continue to increase year over year. And so when you look at what the providers are really required to do, it's not tenable to manually perform this outreach for health maintenance for your entire patient population. So, Jim, I mean, there's been a huge amount of demand for a digital communication strategy around the outreach proactively to patients that have health maintenance that is due, and being able to provide that outreach, help the patient coordinate the next step, but then really be able to integrate that outreach as a documented note back into the EHR, because ultimately that data is going to be used to report for those value-based care requirements. And so it's required to be able to show that you're proactively doing that outreach. And it's also a huge benefit if you're doing this digitally. From a data perspective, you can see who received the outreach, and then you also have the ability to track whether they were converted to a scheduled appointment.
Yeah, Dan, I think that's really helpful. And I think, as you mentioned earlier, being that force multiplier is important, and has really been one of the limiting factors on successfully being able to engage a large population. Thanks, Judson and Dan, for the commentary and insight here. I want to make sure that I see a lot of questions pouring in into the Q&A box. Aaliyah, would you mind covering some of the questions for the audience with the time remaining?
Yeah, absolutely. Thank you so much to Judson, Jim, Dan, Liz, and Sarah for just a fantastic presentation. For the audience, we will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We've already had a ton of great questions come through during the presentation, so I will get started with some of those. So the first question that I have for the team is, can you describe how protected health information and security is addressed with text?
Sure. This is Dan Malolo. I can definitely answer that. Oh, I'm sorry. Go ahead.
Sorry, Dan. This is Sarah. I was just going to jump in and just offer real quick from our experience with texting, how we handle that. So PHI is when patients have the ability to text with our front desk teammates through the virtual waiting platform, there is a risk for them to start to divulge too much information or share some protected health information. And anytime a patient starts to do that unsolicited, because we are not asking them for that information over text, we encourage them to come inside the office so we can have that conversation face-to-face in a secure environment where we're not sending text messages over SMS related to protected health information.
Yeah, yeah, and this is Dan. I would just add, it's all about, providing the minimum amount of information necessary to fulfill or satisfy the intended purpose, right? And so just being really mindful of that and just complying with the minimum necessary standard. That's really the name of the game.
Awesome. Thank you both so much. That's super helpful to know. So the next question I have for the Ensemble team is just, can you point out some of the differences from Epic and why it makes the most sense to maybe have a different solution as well?
Yeah, maybe let Dan touch on that. I think we believe Epic is the best, and I would say the best EMR system out there. I think there's some uniquenesses around how Dan has built ODESA to interact seamlessly with Epic. But Dan, I'll let you touch on that.
Sure. Yeah, I mean, as Judson just said, if you're thinking about the the Epic MyChart portal, it's a fantastic tool. It definitely is an amazing point of initiation, right? So really, it's about how do you kind of engage with patients in the most effective way, right? And so think about the Uber app or something like that. I don't open the Uber app if they send me a push notification. It's some sort of solicitous type of call to action. I don't go to the app unless I need to order a car, right? So it's my point of initiation for something that I need. If I get a text message or some other type of digital communication, from my healthcare provider, I'm going to see it much faster and I'm going to take action on it. Whereas if you're trying to bundle all of these different communication workflows, and I'm talking about things like patients that need to schedule referrals, patients that have, an update to their prior authorization status, insurance billing updates to keep patients informed with the status of a bill that's being, paid by insurance, because ultimately we want to keep them apprised of when they're going to need to be paying their remaining portion of the balance. All of these things are different workflows, and trying to bundle that into an app becomes very cumbersome and hard for the patient to navigate. And it's really effective to kind of bring that communication outside of the app when necessary, right? Keep the very clinical information in there, keep your test results in there. All of that is important. But you can use these digital communications to drive patients to the app when necessary. And if there's, some type of communication that, a back and forth kind of automated response in a two-way fashion with the patient would suffice, that's the most seamless way to do it, right? Why ask them to go into the app if a simple, yes or no response from the patient would basically satisfy, and you're bringing that information to them outside of the app. So that's really what it's all about when trying to remove friction, right? Just eliminate the points at which the app isn't really necessary. If there's information you can bring through a digital communication channel, go ahead and do it. If you can make it interactive where it's going to integrate back with the EHR, do it. And that's really what ODESA has focused on.
I think that's helpful. And Sarah and Liz, I'd love to understand what you guys see in terms of adoption there. I know for an engaged user, someone who's actively managing their health, they're very savvy. They want all that information there. The applications from health systems, from MyChart, others are extremely helpful. And for those who are engaged and want that, that is their one-stop shop for all of this. However, there's a number of, as we talk about the different types of patients out there, not all patients are engaged or that active. And I think really what the focus is to be able to reach all patients, not just those who are actively engaged. Do you guys have insights or statistics into your your adoption rates at Atrium of the different applications and portals that you have available?
This is Sarah. We have seen an uptick in our adoption rate since COVID, and I think it forced a lot of our patients that hadn't been users of our portal before into that method of communication because of how our care delivery turned to a more virtual setting. And we implemented a virtual waiting platform, and we're asking our patients to text to check in. So we have seen a rise in that. What we want to see is that sustain. And we want to see us continue to contact our patients through the portal. And that's something that we're continuing to work on over time. And with our check-in design, that's really our big push to continue that involvement from the patient technology perspective to make that digital touchless check-in experience, and to continue to educate our patients on the portal so that those that aren't users or those that traditionally have not been early adopters of technology feel comfortable with it, understand how to use it, and join us in using the portal.
And I'll just add on to that for consumer chat, we have seen a significant increase in patient engagement or consumer engagement as well. With our previous vendor, we had about 160 chats a month, and now we are receiving live chats, about 400 live chats or more a month, which is an incredible way to allow for consumers to engage with us and schedule appointments and get the help that they need.
Awesome. Thank you so much, Sarah and Liz. That's super helpful to know. The next question I have is for both of you as well. And our audience member would like to know if Atrium offers online scheduling on their website or if patients have to call to make an appointment.
We do. We offer online scheduling on our website through our provider directory, and that is what our chat is linked to. So you can click on schedule an appointment, and you'll actually have a map pop up in the chat, and you can figure out where your provider that you selected is located and have all the information. Once you select a time that you would like to see that provider, it does book through the website, or you have the option to book through the patient portal. So you can either log in online or do it through your app, or you can call. So we actually have a couple of different options there.
Awesome. That's great. Thanks for clarifying. So the next question I have for the panel is, can you describe how you measure ROI and KPI improvement?
Yeah, this is Dan. I'd be happy to answer that. Super important, and one of the advantages of the unified digital communication strategy is you're able to, the system is able to track every outreach that was sent, and then we're able to kind of track, like, did that actually result in the desired outcome? So if it's like doing outreach for patients that have a referral to see a specialist, we have a live scheduling feed that we get in real time. So those messages are sent out, and we're tracking if the patient actually converted to that scheduled visit that we expected within a certain period of time. And so from a KPI perspective, when it's trying to convert to a scheduled appointment, right, you're tracking a KPI as your conversion rate. Same thing with population health. For self-payment outreach, we're looking at the payment rate. We're looking at the source of the payments. We want to see more, payments being made in a self-service manner. So trying to track cost reduction through that. One of the other things for the, for waitlisting and backfilling of canceled appointments, there's a lot of really fascinating metrics there. One thing that we're looking at is, how much, kind of revenue are we actually delivering from like a net revenue perspective. So kind of measuring, what was the kind of slot utilization rate prior, and then, with the new technology, what does it look like now? So kind of measuring what the, increase in net revenue from a kind of patient volume perspective looks like. Then you can kind of tie the, kind of average reimbursement on a per visit basis at each department. You can kind of figure out what that financial looks like, apply it to the, appointments that you're filling that are new, and really come up with an overall net revenue impact for backfilling unfilled appointments.
Thank you so much. That's super helpful. So the next question that we have is, when it comes to showing how digital communications can supplement existing investments such as a portal or app, what advice can you offer to gain stakeholder buy-in? Maybe Sarah or Liz, can you describe how you gained stakeholder buy-in at Atrium?
Sure. Yeah, this is Sarah. So this is something that we found was extremely important, as Liz mentioned before, to have that operational buy-in, and they're the leaders that are going to be driving the performance of these tools going forward. So this is something we did early on in our project to partner with each of our service lines to get their buy-in, explain what we're doing, what the strategy is, and then we had a service line representative from each of those areas that was involved in our work groups, and they helped to design and implement all of these different projects within their different care divisions. So whether that's family medicine, internal medicine, children's division, whichever, across all of our service lines, so that they understood all the nuance within their specialty and could best incorporate it with their existing workflows.
Yeah, and I'll just add to that, this is Liz, that in order to excel at execution, you have to master the fundamentals, share the score, and raise the bar, right? So what we do is when we roll out anything to our service lines or care divisions, we do it in groups so that we can launch 3, really learn from them, and we really want to master it and make sure that we make any tweaks or enhancements. And then we share the score not only with them, but with the other service lines so that they can see early wins. They can start to understand the impact. They can hear from other operational leaders. And one of the things that Sarah and team did really well is they utilized the Teams platform and had an ongoing chat after the training took place, where all of the practice managers and leaders across all these practices could share feedback on how it was working day to day. And she had specific teammates who were leads on those chat messages and would reach out to folks to help them resolve any issues, or she even had a team of people go out to practices to those folks who were struggling with the implementation and really needed support on site. So we have lots of different resources and ways of supporting folks so that they can drive and excel at execution. And then from there, we ask for their feedback. We want to know, how can we make it better? What challenges are you seeing? There's one mailbox for our team, and we get questions and we get concerns and we get great wins when they have a great win from a patient experience that they share with us. And Sarah's team is excellent at not only responding to those, but making sure that they take them into account as they're building their operational support plans to include, where do we need additional training? Where does the leader need to have a one-on-one conversation? What do we need to adjust in the platform to ensure that we continue to excel at this so that our patients do have the best experience, but also so do our leaders and our teammates.
Awesome. Thank you both so much. That's really important, like having that feedback to make sure that you can adjust, and also making sure they have the resources needed to execute. Thank you so much. That's very helpful. The next question that we have is, can you share an example of how we'd use a text message as an entry point to our existing app?
Yeah, absolutely. So Sarah mentioned that we have our e-check-in, and we're enhancing that to allow for patients to check in fully through the app. So for virtual waiting, once they arrive, we remind them to do their e-check-in. We also remind them the day, I think, before, 24 hours before, to complete their e-check-in. So it's a really simple process for them when they do arrive to the practice. Really, that's a link to open up our app. And one of the things that we requested early on was that it not take you to the App Store, but it open up the app, because you don't want to remember a password and you don't necessarily always remember every password to everything. So we wanted it to open the app so you could use your fingerprint ID or your Face ID to open up your patient portal, complete your e-check-in, see any updated information, and have easy access to be able to do what you need for your appointments.
Awesome. Thanks for sharing that example, Liz. So the next question is really around the shift to digital. And the audience member wants to know, do patients really prefer 100% digital, what is that data telling us?
Yeah, this is Dan. I'd be happy to answer that. Really, some patients may not prefer 100% digital, right? It's definitely not all patients prefer it. The vast majority, from what we've seen, truly from a data perspective, the vast majority do prefer it. At Atrium specifically, I think 97%, it's a very high number in the 90s, of their patients are receiving text messages, very low opt-out rates. I absolutely think that the human touch is still an extremely important component of healthcare. And, really like the focus here is trying to automate a lot of these digital communications that are being done manually. And, in that way, you're able to help free up the staff to have more, hands-on personal, or whether it's over the phone or in person, right? It's just that personal interaction, giving the front desk more time to actually have that so that they're not like trying to, talk to a patient in person while juggling multiple patients on hold on the phone, right? So it's really striking that balance. And, in terms of giving the patient their choice, the patient gets to control which channel they can opt out altogether, in which case the communication is going to have to come through a separate means. And that's kind of for the health system to decide how they want to accomplish that. But, what we're seeing from a data perspective is that the majority of folks prefer text message, followed by email, and then IVR phone calls as their tertiary option.
And this is Jim Gaffney, and in my role I get to do quite a bit of research and industry studies. And one of the things that we've seen is that this is a driving factor in who patients choose, especially on the physician side. And patients will actually leave or have left because they've had a poor digital experience. One of the most important things is convenience and ease of use, and allowing patients to self-service, especially around some of these areas where we're just collecting information, or it feels like more administrative. I want a quick change to my appointment or a quick reminder. That's really what patients are used to be engaging. That makes things much easier for them. But to Dan's point, that certainly does not take away from the meaningful interactions. We'd much rather have staff be spending time talking to the patient about their condition, getting to know them, how they're feeling, and not filling out the paperwork part that can be, boring or feel like a pressure situation to get that done and turned in so you can actually get in for your care. So I think offering these options is certainly what consumers are demanding, and allowing all of our providers to spend much more time on more meaningful interactions.
Thank you so much, Dan and Jim. So it looks like we have time for one more question before the top of the hour. And that question is, what is the time frame allowed to reschedule appointments through the app?
So this is Dan, I'd love to get Sarah and Liz's, points on this. But really the rescheduling is available directly through the text message channel. So somebody gets an appointment reminder and they have the option to confirm, cancel, or reschedule. And the next, I think, 3 provider slots are displayed to the patient through text message, and they just simply reply with a letter indicating which date and time they want. But Liz and Sarah, do you want to talk a little bit more about like operationally some of those like configuration points around like time frames and everything that we've enabled?
Yeah, so this is Sarah. We decided to look 2 months out into the future for those next available appointments. So if unfortunately, in some cases there may not be for some different departments, just depending on the specialty, but if there aren't, then it would just ask the patient to call the department phone number, and they would have to schedule their appointment over the phone with an agent.
Awesome. Well, thank you so much. That is all the time we have for today. I want to thank Judson, Jim, Dan, Liz, and Sarah for their excellent presentation, and Ensemble Health Partners for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.